joining me now is to discuss Safe Womanhood Day 2025 with emphasis on maternal mortality in Nigeria is Dr. Ukaire, Director of Family Health, Federal Ministry of Health and Social Welfare. Thank you so much for joining us on Newsnet. We saw you there in that report, making some interventions, but it's good to have you here live. When we hear the Minister of Health and Social Welfare, Ali Pati, say no woman should die while giving life, I mean, when you consider the figures that we're recording in Nigeria, over 1,000 deaths of 100,000 live births in Nigeria, it almost seems we're just paying lip service to the idea that no woman should die giving life. Let's talk about that. Let's start from there.
Okay, what I would say is that currently the NDHS statistics for maternal mortality in Nigeria, we're working with as far back as 2018 is 512 deaths per 100,000 women. And actually, no woman should die while giving birth because it's a physiological, it's a normal situation. And most of the causes that lead to these deaths are very preventable. There are things we can manage. And so there's really no justification that a woman should die if we do the necessary things. And this has informed why the present leadership of the ministry, the coordinating minister, strongly enabled by the President Tinubu, has doing a lot to change the trajectory and create an enabling environment to ensure that no woman dies during birth. Presently, if you want to consider maternal mortality, you see that we are celebrating this Safe Motherhood Day as a way of raising awareness. Right. Because we realize the importance of preventive care. We realize the importance that the woman herself, the individual, the role the individual has to play with respect to her health. And also the role that the community, the caregivers, the husband, the relations, all those around, even, the taxi driver, everybody has a role to play in reducing the maternal mortality in this country. Because like the minister said, there are various factors, so many things that cause delays, delay to get in hospital, delay to making the right decisions, socio-cultural norms and all that, and delay in getting the adequate care. And also you find that the minister, since he came, he has taken the bull by the horn and is very visionary and ensuring that we have the basic healthcare provision fund, and this fund is now for the first time being allocated and released to the primary PHCs.
Okay,
at the
that's
right
primary
time.
health care.
Yes.
And I'm glad you even talked about that. To what extent has this release of funds reflected in primary health care, especially in the underserved, in the rural areas where, they bear a huge burden of, maternal mortality in Nigeria?
We're on the right course. A lot is happening. Several PHCs have been revitalized, refurbished, and are being made functional because with that money they are getting monthly, they are able to, the management of the PHCs are now able to ensure that they have solar, they have the basic equipments, adequate human resource for health to ensure functionality of the PHCs. And it's been designed in such a way that we have PHCs in each ward being revitalized, being refurbished in terms of human resources, material resources, and financial resources. So, and they are being monitored. There's a special process through which this money is being disbursed to them, and also. Sorry.
Well, you're talking about, the what is being done to, upgrade the primary health centers across the country. And it's interesting that it's even as far as the ward level, which is quite impressive. But, going forward, what exactly is the projection in terms of the numbers to improve from this 1,047, though you say it's around 500. What is the projected number and what's the timeline that will give you a sense of true progress as far as maternal mortality is concerned?
Actually, right now, we usually run with the global targets, which is the Sustainable Development Goals,
Right.
which has a mark 70 for maternal mortality, that countries should at least get to below that.
Right.
However, in Nigeria, we are still at 512. We are awaiting the 2023-24 NDHS result on maternal mortality, which I believe will be released very soon. And we are hoping that it's going to be much lower. And
What's the biggest challenge in delivering, you know, healthcare to would-be mothers? I mean, in that report, there's a mention of funding. You say funding has been, you know, taken care of. But what about training of, you know, birth attendants?
Certainly, there is multifactorial. There are so many factors that will lead to reduction of maternal mortality. It has the human factor, the girl factor, education. It has to be educated. It has to be empowered by information, you know, from the media, from different, you know. You find that when we're growing up as young girls, you read books and all this. It empowers you to know how to take care of yourself during pregnancy, take the right decision, and even obey the instructions. Have supervised pregnancy, ensure that your delivery is supervised and all that. This must be done by skilled birth attendants, and that is why even the present leadership of the ministry has ensured training of frontline healthcare workers, especially those who provide maternal, newborn, and child health services. Presently, about the target is to train about 120,000. About 60,000 have been trained presently.
So far?
Yes.
Right.
Yes. So
the rural areas, are they focused in terms of where this trained
yes, the rural and underserved areas, yes, are the main focus. And in fact, even to increase access, through the Nigerian Health Insurance Agency, most of the indigent and vulnerable ones are being empowered, you know, so that they have less out-of-pocket expenditure to be able to access health. And that is happening a lot. The enrollment has increased tremendously, more than we've ever recorded prior to now.
All right, we'll have to leave it there. Thank you very much. Hope this time next year you'll have more success stories to share with us. I have to say thank you very much. Dr. Binyere Ukaire is the Director of Family Health Department at the Federal Ministry of Health. Thank you very much.